It should tuck in when you motion it. So that one tucks, 3 tucks, 4 tucks, 5 tucks, 6 tucks, 7 is pushing my finger back out. Okay?
Yeah.
So 7's out of place in here.
Okay.
Right. And so now that
So you got your fingers on the spinous.
Yeah.
Okay.
Yeah. And so now that I know that, I can put her head down, because that's how you motion lower cervicals, right?
Okay.
Turn it this way, it moves. This way, it doesn't. So she's got a PL.
Okay.
Right? It's that easy.
All right. A PL, left rotation, fixation.
PL.
I mean,
PL spinous.
PL spinous. Okay.
Yeah.
So basically, it's rotating. It's having a hard time rotating to the right.
Yeah, she can't. Yeah, she can't look right, or she can't look left.
She can't look.
It's gone this way.
Okay, I see.
It has to go.
All right.
So, but that's how you do it. And so you can do that same thing all the way down, but you have to really put an extension all the way down to about T4, and then after that, I actually take my patients to a knee chest table, and
so you really get behind that spinous and you really try to push it back to see how far it goes.
Yeah, you just get behind it and then see if it sinks in. You'll feel it. Yeah, that one sinks in.
Yeah.
Anyway, but like for the rest of those, I get onto a knee chest table and I just kind of get up under it and push on it, and it's, you know, that springiness that Dr. Hickey talks about?
Sure.
Yeah, you learn real fast what that is. And so if it's got that springiness, then it's fine. But if it's, let's see. She's got something right here. Does that hurt?
No, above it.
Right here? Oh, yeah, that one. So this is like a wall. It's not moving at all. So you can press in here and it bounces.
Okay, so
you can press in here and it's not moving at all.
Sure. So you're looking for that springiness.
Yeah.
Thoracic and cervical drop. You want to have more of your body left when you retire. In order to have more of your body left when you retire, you have to do things under the heading of working smart, not hard. Okay? So, if your patient has a foot problem like we just did, okay? So,
Mine are perfect.
okay, let's see. I'm trying to find somebody. I don't have a lot of, you have longer legs. Okay. Put your knee like this and your foot like this, please.
On this table or that table?
Yeah, you can stay on this table right here. Let's come around to this side. Go over to this side. Yes. I'm just going to stay up on it. I'm not going to do it.
That's what you told me. Oh my gosh, you're right.
Okay. Put your hands on that. Lean forward. Lift your ankle up. There you go. Now, slide your knee down. Good. So see, I'm here. So now, I have the towel to support the ankle mortise and the foot in dorsiflexion. Yes? Which, right or left leg?
That is a right.
Right leg. So
Right.
navicular is with my
Right.
right. Cuneiform, first metatarsal base, cuboid. Navicular, cuneiform, first metatarsal base, cuboid. Okay? Does that make sense? Okay. Please roll up something and do this on your table. Okay? Heather. Daniel. Joseph. D. Elena.
Here.
Taylor. So please to turn around. So you need to have your body
find out for you.
Teresa Smith.
Yes.
My condolences.
Thank you.
Simon. Tom. Shepard. Are you on the roll now?
Yes. Go to Target and buy rubber bands.
We're just meeting Drager. Joseph Drager. So, was he here earlier?
No, Joe was a lecture.
Joe was.
Oh, yes, he was here. He wasn't.
I saw his stuff. His stuff was here.
He was definitely here.
For one lecture. I'll give him one
Sorry,
lecture.
wait, where did he go?
What?
Oh, never mind.
You got a patient, you got a treat.
I'm just worried. We don't treat patients.
So remember I said that I encourage your adult free will to do what you want and spend the time the way you want to? If you're not here, you're not here. And I applaud your dedication to the inflexibility of your patients. I'm just saying. I'm just saying. Okay. You have to push a bureaucracy. A bureaucracy will not cater to you. Okay. Have we all done setups on this?
Hold on. We haven't done both yet.
Okay. So does this help? So does this help to fold the adjustments together? 1, 2. So here we have 4 adjustments that you practice in this position. You have 4 adjustments to practice in this position. We had talus, calcaneus, braid, pull. Thumb and yielding space. So when you're practicing these on each other, at least every day between now and next week, we're going to do this. Please, at least once a day. Okay? 1, 4, 5, 6. Boom. 1, 2, 3, 4, 5, 6, 7. Okay. If you want to add cheers in here. So there's one that I just want to show you. Everybody do your orthogonal. Now you just pull it in a little bit. So your knuckle is under the bottom of the toe. Okay? And see how our knuckle comes up through the top of our foot? This, I'm just on the dips and pips. Got to get into the callus to go that way. So you pull in, set up that way. Okay?
Smile.
Okay? So see how I'm going up here, and that way it's not this way. You're not pulling down, you're setting it up. Don't pull down, set it up. Or you can traction and set up with your thumb. Traction and set up with your thumb. So you open the joint and set it. Yes, yes? Now, to do the cheers adjustment, please say 2 through 5. Which toes do you do the cheers adjustment?
2 through 5.
Again.
2 through 5.
Again.
2 through 5.
Okay, do not do that on the big toe. If you just really pop it, it'll be painful for 3 to 8 weeks. That's a bad thing. Okay, not a practice builder. Okay, so if you want to do 8 on the top and 4 on the bottom, 1, 2, 3, 4, 5, 6, 7, 8. Okay? 1, 2, 3, 4, 5, 6, 7, 8. Okay? Then with the person face down. 1, 2, 3, 4. 1, 2, 3, 4, or standing with the knee on the table. So you think you can just at least do those once or twice a day? every day between now. It should take you less than 10 minutes. Can you invest 60 minutes between now and next Tuesday?
And by the way, I'm going to be in the Friday open lab for the next couple weeks.
To do, yeah, so because you have those 3 5-point things. Okay, so fibula, please come over here. Venga aquí, por favor.
Sí, señor.
Muy bien.
Miran aquí. Okay, so the fibula is not the weight-bearing joint of the leg. It's the dynamic shock absorber. It's dynamic in generating afference to your brain. It's dynamic in storing, releasing potential and kinetic energy. If it's free at both ends and free in the middle. It has to float at both joints and the interosseous membrane. Okay? So the groove that receives the fibula, okay, so the groove, you know, the groove in the tibia, so the fibula should do this, this, and this. So far, so good? So, if it's stuck here, what's our listing? Stuck.
Well, stuck here.
Yeah, here. Yeah. Have the syndesmosis joint in here. So, what do we need to do? We need to free it. We need to free it this way. We need to free it this way. We need to free it this way at this joint. So far, so good? Now, when I palpate the membrane, I need to stretch the bone like this to feel the interosseous membrane. The fibula is very dynamic. It does flex a lot. So I'm going to be flexing through the fibula to feel, ooh, it's really stuck there and it really hurts. Okay, move, move, oh, it's really stuck. There's a synovial joint here and a fibrous joint here. There's a space, and the interosseous membrane goes from about here to here. There's a joint, a space, interosseous membrane. That spot right there is frequently stuck. So you free up wherever the injuries are in here, you free the bottom and the top. So one of the adjustments we're going to do, or the palpation we're going to do first, is I'm going to take my knuckle here and grab the tibia. Can you see where I'm grabbing the tibia from behind? I'm grabbing it with my thumb. So I'm pinching the tibia. And I'm taking my hand here and pushing the fibula, roll it up, roll it back, roll it up. So my hands are doing this. Okay? Grab and twist. Now, am I looking for centimeters of motion or millimeters of motion?
Millimeter.
Millimeters of motion, a few millimeters, just so it moves and gives. If I put my finger here and dorsiflex the foot, what should I feel? It should feel the fibula going up and down under my finger. Centimeters or millimeters? Millimeters. If I have the foot like this, and I put my finger on top, and dorsiflex and plantarflex, what should I feel at the proximal end? You should feel it going up and down. Now the joint line, can you see where the joint line is on the fibula here at the proximal end? See how the fibula is under the lateral tibial plateau? The proximal fibula is under the lateral tibial plateau. So, true or false? The joint that receives the fibula on the tibia at the proximal end is flat in the sagittal plane.
Oh.
False. It's angled this way and this way, so the joint line is oblique through the joint in this direction. If I palpate it on the sagittal plane, it goes back, but it doesn't come forward. So a lot of chiropractors say, oh, it must be stuck posterior because it doesn't pull forward. No, you're pulling it into the tibia. If you went sideways, and go bears, give me a C. Good, okay, come on bears. Hey, it's all blue and gold here. There's no booze in this room. Okay, so when you take your C, You grab between the gastroc heads on your thumb, and you make a bracket and you pull this way with a neutral open-end wrench. You don't pull and push. See how I'm breaking my wrist? Open-end wrench, an angled open-end wrench, and you're pulling in one piece this way. That's how you feel the motion. So, here's the palpation. Grab the tibia, scoop, 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 up, down, up, down, up, down, up, down, obliquely in and out, on the table, pushing through. So far, so good. Lie on your back. Okay, drop this one down. Okay, so grab the tibia, push, 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 up, down, up, down, up, down. Bend your knee, up, down, okay? Now, do I grab this way to palpate? No, I have to bring my body right into here, take my hand in this position, pull lateral medial. It slides on the joint line. On many of you in here, it slides a lot. It's not hypermobile, it's supposed to move a lot. Okay? Bikini pose, facing this way, lay this side down, on your elbow. Okay, scoot your butt back, scoot your butt back. Bottom leg straight. Bottom leg straight. Put your knee right here, top knee right here. Okay, all the way down. Okay, put this hand like this, hand open. There you go. Okay, back down. Knee touching. Okay, there you go. Now to get the knee up a little higher to hide the joint. Okay, there you go. Back up a little bit more. There you go. Yeah, the Burt Reynolds pose. Now see how the leg is down on the ground, so I can come in and really push in on the interosseous membrane looking for adhesion. Ooh, that one don't feel good. It bounces here. Right there it doesn't. So can I move that one? All you do is you load in, and you hit that son of a bitch as hard as you can, because you want to release that adhesion in that interosseous membrane. One, two, and then you go back, and there's more motion in the interosseous membrane. Soccer players, Muay Thai people, Taekwondo, anybody who catches a lot of kicks in here. Rob McGraw. I'm glad he's got the rear view. Okay.
I'm making sure I don't get that.
Okay, so let's pair up. We're going to palpate the distal end, the up and down, go bears, interosseous membrane. Let's do that palpation now, please. There you go. So, first thing I'm going to do is make a bracket to hold the tibia. Take my fleshy pisiform right into this groove here. The syndesmosis joint is about this long. Okay? So I'm going to take my contact, I'm going to just tap it up and down here. You have a drop piece or speeder board through here, that works well. Now remember, the groove that receives the fibula is like this. So I want this joint facet to be perpendicular to the table. How do I have to rotate the foot to get this perpendicular to the table? Turn the rotation. Got it? Bracket, contact, squeeze, engage, rotate, set. Bracket, engage, squeeze it in, rotate, set, 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 set. Boom, 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 boom. Is this a synovial joint? No, it's felt with Elmer's glue. It's dry. It's hard. What do I have to do to glue?
Crunch it up.
I have to crunch it up so it becomes a little cracked up inside, so that the body can rehydrate and take it away if it can, as much as it can. It's never going to be right again, but it can be functional. Boom, boom, boom. Okay, got that so far? Okay, now patient gets in bikini pose, and you hit it this way, inferior to superior. 6 to 12, 7 to 1, 5 to 11. So I hit it up, this way, up, this way, this way. If I just do it this way, it seems to loosen it up better. If you have a big person, if this is moving, sometimes I'll even take my hand, see the joint line is this way? I'll push this up as I push this up at the same time. I'll show you how you do that with the drop tapes. So far so good. Bracket push. Bikini pose, prone. Do the same thing, bracket push from the back. So that's for what injury? High ankle sprain. You need to get it up and down. You got to get it forward and back. So far, so good. Okay. So now for a, what if this fibula really isn't coming forward? It is stuck posterior. Okay. This is the patient's what leg? Right leg. Okay. So if it's on the side of the table, I put the ankle on my inside shoulder. Hook behind the fibula with my fleshy pisiform, and then angle it medial lateral on the joint line. So that's to eye, medial lateral. Okay, when you're on the table, don't put your head between your patient's legs. Okay? That would be bad. Okay, always have the foot on your outside shoulder and hook and pull. Okay, so drop, leg. Okay, I'll be standing up. Heel is off the table. Find the contact. Brace. Bracket braces. Engage. Squeeze together. Set. 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 Bikini pose this way. Okay. Set. 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 If they're big, do it both ends. Yes. Interosseous membrane release. Yes? Yeah. Okay. Face down. Posterior. Find the fibula. Hook. Bring your body out. Pull across in the joint line. See where the joint line is? Right past my hip. Okay? Roll over. Ah, forgot. Face down. Sorry. We did the hook, and now we do the pound from the back. Face up. Bam, 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 bam. Okay, I would do it. Let's see, I'll do it. Okay. Bam, 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 bam. Yes. Bikini pose. Bam, 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 bam. Bikini pose. Interosseous membrane. Face down. P to A. Break it up from the back. Roll over. Bracket, bracket, bracket. Bikini pose. Inferior to superior. 6 to 12. 7 to 1. 5 to 11. Boom, boom, boom. Interosseous membrane. Face down. Posterior fibula. Posterior fibula here. Okay? Let's pair up and do that cycle. Let's do that cycle. Foot adjustments. Do the 8 supine foot adjustments. Do the 4 prone foot adjustments. Maybe that might be something we could do. Want to try that?
Yes.
Okay, I'm going to say that's the way that we do it. If I choose not to do it that way, it's in your favor?
Yes.
Okay, but you've got to practice it in these modules so you get them and link them together. Okay? You are my lab rats. We're seeing how this works.